Drug abuse and its repercussions have long been pressing issues that transcend socioeconomic boundaries, affecting communities globally. The intertwining challenges of drug abuse, homelessness, and the opioid crisis have created a complex web of social issues that demand careful examination. In recent years, the emergence of novel substances like xylazine has added another layer to this intricate problem. The opioid crisis in the United States has reached alarming proportions, claiming countless lives and devastating communities. Characterized by the widespread misuse of prescription opioids, such as oxycodone and fentanyl, the crisis has given rise to a surge in opioid-related overdoses. Factors contributing to this epidemic includes overprescription of pain medication, inadequate regulation, and the subsequent transition to illicit opioids. The repercussions of the opioid crisis extend beyond the individual level, affecting families, communities, and the healthcare system. Addiction often leads to a vicious cycle of unemployment, homelessness, and criminal activity, amplifying the strain on society. Xylazine has found its way into the illicit drug market, particularly in regions grappling with the opioid addiction. The drug, known colloquially as tranq or zombie, poses significant health risk due to its potency and unpredictable effects. Xylazine exacerbates the challenges posed by the opioid crisis. The drug's sedative properties can lead to respiratory depression, increasing the likelihood of overdose. Moreover, the emergence of xylazine highlights the adaptability. Emerging drug trends pose an ongoing challenge for public health, law enforcement, as societal dynamics evolve and the global landscape of drug. Understanding and addressing these emerging drug trends is critical to developing effective strategies for prevention, harm reduction, and treatment. One significant trend that has gained attention in recent years is the use of synthetic opioids such as fentanyl and carfentanil. These potent substances, originally developed for medical purposes, have found their way into the alarming potency of synthetic opioids increases the risk of overdose even with small quantities, posing a severe threat to public health. The internet and advancement in technology have played a pivotal role in the rise of novel psychoactive substances. These substances, often designed to mimic the effects of traditional illicit drugs, are created by modifying the chemical structure of existing compounds. As legislation struggles to keep up with the ever-expanding list of these substances. Cathinones, commonly referred to as bath salts, represents another category of emerging drugs. These synthetic individuals may unknowingly ingest multiple substances, increasing the likelihood of the intricate relationship between communities. The intersection of these two challenges creates a compounding effect, exacerbating the difficulties faced by those. Homelessness often serves as both a cause and a consequence of drug abuse. Individuals experiencing homelessness frequently confront a myriad of stressors, including lack of stable housing, unemployment, and social isolation. In an attempt to cope with the harsh realities of life on the streets, many turn to substance abuse as a means of escape. The connection between homelessness and drug abuse is further underscored by the financial strain experienced by individuals living on the street. The need for daily survival, coupled with limited access to resources, can drive individuals to engage in illegal activities, such as theft or panhandling, to support their substance abuse habits. Individuals may find themselves without a support system or a stable living situation, ultimately culminating in homelessness. The challenges faced by homeless individuals with substance abuse issues are compounded by social stigma and limited access to healthcare services. The pervasive stigma surrounding addiction can create barriers to seeking help, as individuals may fear judgment or rejection from society. Additionally, homeless individuals often encounter difficulties accessing essential healthcare services, including mental health and addiction treatment, perpetuating a cycle of unmet needs. Kensington Avenue in Philadelphia, a thoroughfare once known for its historical significance, has unfortunately gained notoriety in recent years due to the profound impact of drug abuse and the opioid crisis on its street. As one of the epicenters of the opioid epidemic, it has become a stark representation of the challenges faced by urban communities struggling with addiction, homelessness, and the associated social issues. The heart of Kensington is marred by open-air drug markets where individuals grappling with addiction seek solace in the consumption of opioids and other substances. The prevalence of makeshift encampments, tents, and discarded syringes paints a disheartening picture of the human toll exacted by the opioid crisis. The streets are rife with individuals in various stages of addiction, their lives entangled in a web of despair and dependency. Homelessness is not merely a consequence of economic hardship, but is intricately linked to the pervasive drug abuse that permeates the area. Many individuals experiencing homelessness have succumbed to addiction, using substances as a means of escaping the harsh realities of life on the streets. The encampments, often located in abandoned buildings or vacant lots, serves as temporary refuge for those with nowhere else to turn.